Now I'd like to talk to you about some of the activities and some of your instructions that I'm going to expect from you after surgery. Now we got a lot of things that we're going to make you do. There's therapists have a lot of ideas, and so do I. But I want you to know what I think are the two most important things. If you can give up everything else and focus on these two things, your knee replacement will go well. So there's two things. Thing one, make sure your knee goes straight. Second thing, make sure your knee bends. Okay? I hope that's easy to remember, but I only really want you to focus on two things. Making sure it goes straight, which I think is one of the most important things, and making sure it bends. Also important, but first priority is first. And that is making sure your knee goes straight. So now you can see I've got an array of different scenarios. I've got this could be a bed, this could be a couch, okay? Let's talk about when you're immediate post-operative. Maybe you're lying in your hospital bed and, oh God, no! Could someone please put a pillow beneath my knee? Oh, woo! Well, that feels good, but I don't want you to do that. That's very bad. What I want you to do is put the pillow, if you put it anywhere, underneath your ankle so that your knee can work on priority number one, going straight. And it looks a little like this. It sort of smarts a little bit when you first start trying to do it, but with time, it'll go straight. And specifically, we want you to prop your knee straight like this for 10 minutes every hour. 10 minutes every hour. A good way to remember that is every time the big hand hits the 12, 8 o'clock, 9 o'clock, 10 o'clock, every hour on the hour, 10 minutes. So wherever you are, even, you're not in the hospital anymore, now you're at home. You're watching TV, people are getting you treats and whatnot. Big hand hits the 12, well, you don't have to go back into bed, get a towel roll, put it underneath your ankle. You can use a chair. It's 10 o'clock, oh, you're gonna have to lift your knee up, prop it up on that chair. And every time you do it, you're going to feel it stretching back there, but that's a good stretch because you want to make sure that you're maintaining your ability to keep your knee straight. And if it gets straight in 10 minutes, great. If it's not quite straight at 10 minutes, give it another 5 minutes. But for a minimum of 10 minutes every hour, no matter where you are, whether you're in bed, whether you're sitting on the couch, and you have to use a chair, maybe you won't use a chair, maybe you use a coffee table with a little towel rolled up like this. I want it to be propped straight for a minimum of 10 minutes every hour. Which hour? Every hour. For every day until I tell you that it's okay to stop doing it. Whew. Okay, so now that we've been working on keeping our knees straight for 10 minutes each hour, I don't want us to lose sight of the second priority, which is sort of the opposite of keeping it straight. I want you to not only keep it straight, but I want you to work on bending it. Well, what do you mean by bending? I mean bending the knee, okay? So how do we do that? We're going to give you a variety of exercises, but I'm sitting in this chair because I think this is the best exercise and the easiest to think of. I just had my knee replacement done, and now I'm going to work on bending it. I bend my knee as much as I can. I'm sitting in this chair. Whew! I can really feel it pulling on the front. It's actually a little uncomfortable, but I'm going to keep my foot firmly planted on the ground and very carefully and very steadily, supported by this chair, I'm going to, and watch my knee, I'm going to move forward in this chair with my foot on the ground, and as I do so, you can feel it, it smarts, but this is bending. And as I go as far forward as I can, I'm going to hold it for 1 minute. After 1 minute passes, I can now rest. Whew. But I only let 1 minute go by, 1 minute of rest, and I do it all over again. For another minute. And I want you to do that 10 times. I call that a cycle of 10. A minute of bending, a minute of rest. A minute of bending, a minute of rest. So you can imagine if you're doing a cycle of 10, it's going to take you 20 minutes. Basically because each cycle takes 2 minutes, okay? And I want you to do that at least 3 times throughout the day. And your goal is, each day, keep track of how much you're bending it. I guess I'd call this about 70 degrees. Well, each day you want to bend it more. How much more? More. Maybe 1 degree, maybe 5 degrees, but each day you need to get more. So now I'm bending to almost 90. The next day I'm bending to practically 90. The next day I'm bending past 90, and so on. Your goal is to get to 120 degrees. It's basically 30 degrees past 90, which is a square. We'll help you get there, but each day I want you to bend it more and more.